Hey, Care Partners. Always great to be back with you. And, I have a special podcast for you because in the business that I do, and now that I run into people sometimes and they know what I do, they'll frequently say, "Oh man, I wish I knew you when I took care of my mom, my dad, husband, my sister, my brother." And that happens all the time. Just last Friday, my husband and I were at a local brewery. It's a family place sitting on a river, and all the beach is lined up with Adirondack chairs, and there's pizza and tacos if you want them, and just hanging out. And don't you know, ran into a woman I knew probably 15 years ago, and hi, how are you? And she goes, "Oh, I wish I knew you when I was taking care of my husband." And so it breaks my heart to think that there are things you wish you knew. And I'll be the first one to tell you that there's no guilt in this job. There's no, you did what you did. You gave as much as you could. You did what you did with the best information that you had. And so the last thing I want to ever do is give you, oh gosh, guilt, remorse, by you hearing new information. No, 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 no. No, but you may be able to help someone else because you have experience in this and you know how hard it is. But today we're going to talk about those questions that people ask me when they say, "Oh, wish I knew." And we'll talk about that. So let's bring up the first slide. And yeah, thanks for being here, Teresa Youngstrom. You know how much I appreciate being here. I just want to tell you how much I appreciate all the support. We're going into season 2 and 50 episodes under our belt and going strong, and the support's been overwhelming. So I just want to reach out and tell you that the support's been so great, and we're just reaching more and more people, and that's what it's all about. It's not about making people feel bad about the job they did. Um, and it's really more about just let's keep educating people until we find a cure, right? So that's what we'll talk about today. Let's bring up slide 2. And because I know you wish you knew, but let's talk about some of those issues. Next slide. So one of the things that I frequently get asked is, gosh, I wish I knew it was a marathon and not a sprint race. Because this thing, dementia is different for everybody, right? Our brains are different. How we respond to this incredible disease is different. And gosh, we have different comorbidities. Our bodies are so already struggling with this, that, or the other, whether it's diabetes or just, arthritis as we get older. So everybody's situation is going to be different. But I tell people, you know, dealing with dementia, whatever diagnosis you get, it's not a race. If anything, it really is much slower. This doesn't take you in 3 months, like say, a pancreatic cancer or something like that. And so it's okay to step back and breathe frequently and get your bearings and reassess and see where we are. I knew a woman who got the diagnosis with her parents, immediately sold their home, put them in a community, and then she said, "Wow, I didn't know. I didn't know it was gonna go like this." And I said, "Well, you didn't know. You didn't know what you didn't know." But let me tell you, those of you that are just entering into this journey with someone whose brain's changing, it's gonna be different, but it doesn't have to be terrible. It could take a long time, okay? So you're gonna have to put your armor on to protect yourself and know how, and you're gonna need to educate yourself on better techniques, and that's why we're here. But, it is not a race. You don't get dementia in, 2 weeks being in the hospital. Can I just say that again? I know I've said it before. This is not something that comes on quickly, from a medication change or from some type of illness that you're dealing with. No, hallucinations don't start overnight. Usually we see trends of things. We start seeing mistakes. We start seeing red flags. And then usually once there's, a bunch of red flags, then we say, okay, we better get this checked out and let's get to the medical doctor and let's see what we have going on here. But it's not a race. Um, it's a marathon. Okay, next slide. Something else that I frequently get is, I wish I knew, that he was sicker than he sounded on the phone. Keep in mind that when we're out of town and we're checking up on our family members, that this disease allows us frequently to have a place to be cordial on the right side of our brain. Language and cognition starts to go early on, but sometimes we're just cordial and it's social chit chat. How are you? Great. Me too. Yeah. Uh huh. Isn't it pretty weather? Yeah. I'm getting warm. And they can have that idle chit chat. My mother certainly could. But then after a while, she would just be done with the phone because she'd exhausted the words that she had in her idle chit chat, her ability to be cordial. And so I hate to tell you, I've shown you over and over pictures of my mom, and can you see the dementia? And, for a long time, you can't see it. And so you really need to have your radar on, be a great detective to know what's going on. And someone needs to be going over and doing visual checks and not just checks on the phone. And I would tell you that home care companies, I helped start one in years past, we would get most of our calls right after a holiday. Why is that? That's right, because people come home to visit and they realize, OMG, had no idea things were this crazy. And then all of a sudden they're bringing help in and trying to see what they can do to come alongside and hopefully join their loved one on the journey, not just whisk them away and change their location where they live. But sometimes they do sound a lot better than they are. So no regrets. But this is a common question, a common statement I get from people who say, I wish I knew. I wish I knew what you teach. So next slide. Another question I get is, I wish I knew that those angry words were really her or his attempt to communicate. As language and cognition declines, they can get more exasperated with us when we can't understand what they're trying to tell us. And unfortunately, it can look like they're super agitated, and what I call the emergency words that are also located on the right side of the brain. There's some good things on the right side of the brain that stay with them: rhythm, prayer, music, and some good things, and that ability to be cordial. But I also call them the emergency words, and my mom had hers. And when she used those curse words, then you knew something was wrong. And it wasn't a time to finger wag her down. It was a time for me to be a detective and for me to start doing a head to toe. What's going on here? What could possibly be going on here? Because usually it's causing pain, fear, anxiety. And so, can you be a good detective? Are you a great caregiver that can hit the pause button when you're hearing those ugly words and they may be directed right at you? Can you hit the pause button, recognize, okay, it's the disease talking, and I need to be a great detective right now. And I need to be able to assess what's going on and see if we can figure out what's causing the pain, the fear, or the anxiety, and not just go for the medication to get them to pipe down. Don't just sedate people into submission. When you realize that that is one of their last attempts to be able to communicate with you, it's all they have left. They're doing the best they can with what they have left. But that emergency word isn't very pretty. It might be ugly. It might be really rude. And it might be super loud, but they're trying to talk to you. They're trying to communicate. I was with someone the other day and their dog gave a little growl. And at first they wanted to reprimand the dog. But what we put together, because I have a sister who is a dog behaviorist, a dog trainer, Judy Moore up in Maine. She's incredible, but she has taught me that that's how a dog communicates. And they may growl, not because they're ready to bite you, but because they're trying to communicate. And this little dog was in the arms of its owner, and another dog had walked up. And what was really going on is that little dog was very uncomfortable with the situation. And that dog that came up had its hair standing up its back. Okay. So there was communication going on. And the little dog was trying to tell its owner, I am very uncomfortable right here. I need to get out of this space. And so it reminded me of how sometimes people who lose their ability to communicate, it might sound like they're growling at you. Okay. They're cussing at you. They're lashing out. I tell you, it's so worth taking the time to see if we can figure out exactly what's going on and, um, and come alongside and maybe we relieve the pain, the ingrown toenail. Maybe they've stubbed their toe. Maybe they've got a skin tear. Maybe they've got a bellyache, got to go to the bathroom. Any one of those things. Okay. All right. Next slide, please. So something else that I frequently get asked is, gosh, I didn't even know that there were visual changes. We teach about when people struggle with brain failures that frequently they lose peripheral vision. Vision will change and it comes in this way, and they only see what's out here. Think of it like your scuba mask vision. And so it's easy to startle somebody. Excuse me. And you startle them, you can get the fist up too, and you might get popped. And I always want to come back to, okay, but guys, who caused that? Who caused it? We did, because we just didn't know. Did we do it on purpose? No, 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 no guilt. Remember, all grace, no guilt in my book. But we got to learn from our mistakes and do it better the next time. Teepa Snow says it goes from a loss of peripheral vision to a binocular and then a monocular, and they'll have trouble with depth perception. They'll start shuffling their feet, looking up, looking down, and maybe they can only see a couple feet in front of them. And then you got to be careful that they're not wearing their cheaters that they use to read the newspaper when they're walking, because their feet are not going to be in the right position if they're looking through a cheater. Okay, just a side note. Um, but anyway, we can really startle and cause a lot of trouble. I was listening to a girlfriend talk about one of her clients, and she said that um, the gentleman who had the brain change would say to his wife, "Why are you always sneaking up on me?" And you know what? The woman didn't realize is she was coming up from behind, like in this picture, and startling him, and he would get quite aggravated because he didn't see her. And I can attest that with my own mom. You know what? My dad could be you know, just a foot to the left of her, and but if she's looking forward and she had lost that peripheral vision, she had no idea what was going on right there. It was all about what's out here. Think about having your scuba mask on and what's in front of you. And that's their world. And you've got to come out in front of them and enter their world from several feet out. Hey, Teresa the nurse, so great to see you, and greet them that way. Tell them who you are. It's a good idea. Give them a smile, put them at ease, pay them a compliment. And Teepa says, don't move in until they acknowledge you. A family member that may come quite easily. But if it's not a family member, if it's a stranger to you, they might need to check you out a little bit. Yep. And see and see if you've got, handcuffs or baseball bats. They can be very paranoid and suspicious depending on what type of brain change they're dealing with. But is it worth it? Yeah, it's just another great technique. And I frequently get that, gosh, I wish I knew about the loss of peripheral vision, because he got so afraid and so paranoid and was striking out. But here we were surprising him. Even the kids would come up from behind and throw their arms around, and he would appear aggressive. Was he being aggressive? Uh, I wasn't there. But chances are he was just being startled, or she was being startled, and that's the result we get. Okay. Let's move on to the next slide. Another question. I wish I knew not to correct or keep reminding. Yeah, correcting thing. We are dealing with our logic and expecting them to be using their logic. But logic pretty much goes away for a lot of individuals. Everyone's different. Treat them as an individual. Personalize your care. I'm all about it. Um, but for the most part, they tend to lose their ability to use their logic. And so you might tell them something and then you're reminding them, and I just told you that. Why do you keep asking me all the time? We already did that, or you already asked me that, or oh, whatever. We got to get over it. And you know what? If it's too exhausting for you guys, then you need to get some help. But I can just tell you that we frequently mess up, and we're doing reminding. We're using the R words. Remember I said, remember I told you, remember I let you know, remember I set up that appointment. Remember, are we really saying that to someone with memory challenges? Remember? Nah, come on, guys. We can do better than that. So the remember thing, yeah, I'm sorry that that happened. For those of you just learning about this, we don't really use the remember word. Okay. I would take it upon yourself, make it your fault. Gosh, I'm sorry. You know what? We are going next Tuesday. I'll put a big note on the refrigerator for you or on your island. Yeah, it's next Tuesday. I'll pick you up at 11, and you better plan on picking them up at least an hour early. You just can't rush folks that have brain change. They're having to process and it's going to be slower. At least it'll get to that point where the processing is much slower. And so we need to be very patient and not rush them. Otherwise, they can get really, really upset. Reminding. Yeah, that's just not a great way to go. But again, being a grace giver, don't beat yourself up about not knowing that. But there are some techniques for those of you that are just learning about this, some great techniques to help you. So I wish I knew not to correct her. Yep, it's something I had to learn for sure. Listen, all these mistakes, probably all of them I have made with my mom and had to learn. And so you guys get to learn from my mistakes. Okay, another question or another statement that people say, I wish I would have known. I wish I would have known that he really didn't see his dementia. You know, there are some people that have awareness and there are other people who don't have awareness. And we keep poking at them like, Dad, we've been to the doctor. He said you have, of course, you can't remember. You have dementia. Oh my gosh, guys, let's not do that. Let's not do that. It's like someone saying, you're 25 pounds overweight. How many times do we have to tell you? That's not going to go over so well. So some people with brain change have awareness. Honey, I'm not anymore. I'm just making mistakes. And then you have some that are, get out of my blankety blank house. I'm a millionaire and I don't need you. Okay. Which I've told you a lot of times about that story. And so we need to come in open minded and with our radar on as to where they are in that moment when you're there. They may be different in the morning, noon, or night. Who has to change? We do. We're the ones who have the capacity to change and join them on their journey. That's what we do. Okay. But we don't keep reminding and throwing darts and poking. How many times do we have to tell you you have dementia? Oh my gosh, you guys, in my world, we never, ever again told my mom she had dementia. It didn't come up and we were not going to say it because she wasn't going to believe you anyway. So why pick that battle? Why fight? Why fight? I don't see any reason to fight with her, right? Let's keep the peace. It's a lot more fun keeping the peace. So a lot of folks, they really wish they'd known that not everybody can see their dementia. And then it's a new care plan. You need them to come and help you. You need to ask them to help you. They think they're smarter than you. If they have the anosognosia and they don't see their disease, well, you can't change it, can't beat it into them, can't talk them into it, can't finger wag them into it, all poor techniques. But you can allow them to come and help you because it makes them feel good about themselves. Gosh, you know what, Mom? I really can't find those socks. I think they're in your bedroom. But if you could just help me, you're such a great finder. Dad, you know that hammer? I'm not sure if it's in the drawer in the garage or if it's hanging up on the wall. If you could help me find that, you're so good in that workshop. So how can you pay them a compliment and ask them to help you? And it may just be in order to get them to come with you away from something that would upset them, away from a situation. It may be because you're going to pass the bathroom and you're going to say, oh, need to jump in here real quick. Hey, did you want to go too? Or something like that in order to get them to go to the bathroom without saying, your pants are wet again. I've been telling you, you need to go to the bathroom. How many times do I have to, oh, you guys, I can hear myself saying things like that. Okay. And then thinking, straighten up, poor technique. Okay. I need grace. I need to get back on top of my game and do it better the next time. And that's what we do. That's all we can do. So I wish I knew that my mom didn't see her dementia early on because I was the one that got kicked out of the blankety blank house and it made me cry. And there are things about caring for these folks that'll make you cry. And I'm well aware. That's another reason that I do what I do. Hopefully, we can shed some techniques and some ideas and some skills along to you so you don't have to endure all those crazy situations that I had to learn from my mistakes. Okay, next slide. Another thing that I hear is, gosh, I wish I knew no miracle drug could fix it. And they can bring a variety of side effects. And it's true, there's no special pill. If you listen to Marion Kiner, who I interviewed a few weeks back, she was incredible. Someone had really asked me, isn't there a pill for Alzheimer's, in all sincerity? And so I brought Marion on to really talk about what we have available, what medications are available. And it's just good to have your radar on for the medicines, because it may be easy for you to give them a medicine, but how it affects them can be crazy. And so antipsychotics and the different medications that we have out there, we just don't have great medications. I'm all for better technique before I'm going to, tell you to try and get great medications to get them to pipe down. It's not my goal. I want them to enjoy life as long as they can. And if it's me that has to put the work in, now I understand there's situations you've got too much going on, you have too many residents. I don't know. Each I don't want to be the judge and jury of how you handled this, but I just want for people who are just entering into this journey, just beware that there's no fixer pill, and sometimes we end up making it worse before we make it better. I've just seen individuals not be able to think as well as they could. They could think this well now, not this well, but this well. And then we give them the antipsychotic and it's woo, and pretty much we're sleeping all the time, or tearful, or something else, or have a different side effect, hallucinating now. And that happens. There are side effects. Everything has a side effect. Your ibuprofen, your Motrin has a side effect. It can cause your stomach lining to be in bad shape, or cause your platelets to go down, right? So everything, I mean, too much Tylenol, that's going to mess you up too. So even simple drugs have side effects. Listen, alcohol has side effects. So we have to choose wisely all these different aspects of how we manage brain change and how we support someone on the journey. And I just hope that you'll give more time and training and education and just more time to learning some better techniques instead of just going for the miracle pill. Yesterday, I was talking to some colleagues, and they had a client whose mom, she went, let me think how that went. She went to, oh, I know, memory care. She went to a memory care after, I don't know if she had been in the hospital, whatever, they had diagnosed her. She ended up in memory care. He fully believed in 2 weeks that she would be better. It's memory care, right? That's a misnomer. Let's see. Do we really do memory care? We care for the individuals, but this gentleman actually thought that they were going to restore her memory in memory care. So naive? Yeah, probably somewhat, but it's not really what we do. This is a chronic debilitating progressive illness, but it doesn't happen overnight. It's not even in a year usually, unless something else is going on. This can be several years. This can be with vascular dementia. We're seeing people live 20 plus years. So we've already determined that it's a marathon. And I just want to be careful about the medications we start introducing. And what is the goal? What is the goal? What are they doing that makes you think they need a medication? Could it be that they're uncomfortable? Could it be that they've got an appendix gone bad? Could it be their gallbladder's acting up? And then we want to medicate it because they're acting out. I just want to hit the pause button. There was a woman that I was helping, and her mom, who lived with her, had in the bathroom, but for some reason decided to take the squares of tissue paper, and she would, after she went to the bathroom, she would line the perimeter of the floor with her tissue, with the squares of toilet paper. And the daughter was beside herself, and she said, "Oh my gosh, I called the doctor and he called something in for me." And I just thought about that, and I thought, do we need something? Do we need to add on another part of a mixture of who knows what we're taking because we're lining the bathroom floor with toilet paper? I'm just saying, if it were me, I would have scooped those up, made a basket into the trash can afterwards, and went about my way. Guys, it's brain change. There's no perfect situation, um, and it we can't fix it. And so frequently we can go with the flow and we don't need to call for another pill, okay? Because there's not one miracle drug out there. I know it can be scary and it's confusing sometimes, like when they all of a sudden don't recognize you, and you're like, "Ay, ay, ay, that was weird." But is it the end of the world? Did anybody get hurt? How do we support them, even in the most challenging times? Okay, next slide. All right. I wish I knew. Yes, definitely. I wish I knew she could still enjoy music, nature, dancing, and children. I wish I knew she could still enjoy those things because they do have that capacity, guys. You know, nature is a beautiful thing, and they don't have to have all this cognitive ability to go enjoy when the daffodils come out or when the flowers are on, blooming on the trees, or the roses are walking through a park and seeing the baby squirrels come out. There's so much, and children, children, children. The Montessori has led the way on that of putting children in the presence of seniors and how wonderful that is, even if they have dementia. Okay, so that is a beautiful thing. Next slide. Just remember that. Okay, I wish I knew that caregiving is not intuitive. Yes, and that I needed help. And this, I am preaching to me. Guys, I thought because I had been a nurse for 30 years that I would know exactly how to take care of this. Guess what? Wrong again. I was wrong again. Um, and it's not intuitive. We learn to take care of babies. They come home and what do they do mostly? They eat a little and they sleep a lot. And we change diapers and we learn how to care for these little beings. But when we have an adult now that needs care, and sadly, the way this works is the care increases. The care doesn't go away. As your child gets older, there's more independence and less care, and you launch them well into independence. But with someone who has brain change, things are declining, they're going backwards. And so we got to keep increasing care. And it's different. It's different. You don't automatically know how to care for these people. And there's more than 120 diagnoses that give us symptoms of dementia. Your person is going to act differently than mine. And that's okay. But we got to figure it out. We got to be open minded and we got to figure it out. Okay. Next slide. Yeah. And I do wish I knew it was all about the relationship. Yeah. And not be so not care so much about the tasks of the day, but to be able to know it's about the relationship first. And, if things aren't going well and she's upset and for some reason doesn't want to get the shower, or he's upset, and okay, hit plan B. Maybe we wash our face and hands and we move on. That is just fine. But it is all about the relationship. And they won't remember, guys, everything you say, but they will remember how you make them feel. I definitely want to get on to that last slide with the puppy because I see we're running out of time. And I just need to tell you a story about this little guy. And yeah, I wish I knew caregiving is personal and it's okay to have fun along the way. It doesn't have to be all pain. It doesn't have to be all work. Isn't that cute little guy? We can really lighten up and make it a good time. We can sing while we give care. We can dance around to get him to be able to walk. We can do a lot of fun things. But the story I want to tell you about the little dog is that there was a woman that I helped take care of. We were friends a long time, went to church with her, took her to church. As she started to decline, found her down in her home, ended up getting her into a local rehab, and then she ended up getting an apartment there because she was declining and she couldn't be independent anymore. And, so while she was there, she was in love with my dog, Jackson, and he's a lab and he was a good boy. And, so I would take her a bag of treats and, take Jackson, and she would be so excited that he would do anything she said. And she said, "I've got this dog trained." And she would tell me, "Nobody can make him do what I do." And I would let that just go. But she'd put a little treat on her shoulder and she'd call him up and tell him to wait. In that lab, he'd stand on his head for a treat. You know how they are. And he would be waiting like this, and then finally she'd say, "Okay." And he'd grab that treat and munch and she'd say, "Wow." And she would all excited, "See what I can do. I've got him trained better than you do." And I would just say, "You're amazing. I don't know how you do this." And I have even video of that I should show you guys, but so, so cute. Well, then COVID happened, and then I couldn't bring Jackson in to see her anymore. Well, fortunately, she was on a first floor, and so I started showing up at her window, and she could still use her phone. And so I'd call her on the phone, I'm talking to her through this great big window, and I'd have Jackson with me. And out her window was a great big field, and we'd toss. He loved to retrieve more than life. And Jackson's still around too. So anyway, I would throw the tennis ball, and she would just love watching through the window. And we'd sing a song, and we always sang, "How much is that doggy in the window?" And she loved that. It'd make her laugh. It brought her so much joy. And so we would start ending every phone call, whether it was me outside the window or me just calling her. We would end every interaction with singing that song, "How much is that doggy in the window?" And truth be told, that she continued to decline. I don't know if it was just loneliness, or lack of interaction with people, not being able to have enough staff to get her out of bed all the time, let her pedal around, but I was watching her decline and watching her decline and watching her decline, and eventually we did move her into, an inpatient hospice unit because she had declined to that point, and, one of the last things that she d interaction she had with me was singing that little song. I mean, literally on her deathbed, "How much is that doggy in the window?" Her little voice, "The one with the waggly tail. How much is that doggy in the window? I do hope that dog's not for sale," is what she would tell me. Sweetest thing, you guys. Listen, this disease brings all kinds of things that are gonna grow you, okay? And you're gonna find some of these little treasures and these little silver lining things that are gonna charge your batteries so you can keep doing what you're doing. It's hard. I do feel bad for people that come to me and say, "I wish I knew," but I just wanna be a grace giver and let you know you did the best you could. I'll give you a hug. You did the best you could with what you had, okay? And you're gonna have to find some peace in that and forgive yourself and move on. But you can still have fun with this. You can still make it about the relationship, and you can sing silly songs for the rest of their life, and they'll enjoy that too, okay? I'm Teresa Youngstrom. This is a better approach to memory care. Memory care with Teresa Youngstrom. I sure hope that you'll like and share and subscribe so we can reach even more people. Okay. And keep in mind, you got this.